Hi, it's Dr. Sweeney here today to talk about the menopause. Now, the menopause has been in the media more and more, and it's essentially when the ovaries fail. The ovaries are the hormone factory in females, and they produce estrogen and progesterone. Estrogen usually makes tissues proliferate and grow within the body. Progesterone opposes that and helps to scale things back. So with regard to, say, a woman's menstrual cycle, estrogen develops the lining of the womb in readiness for an egg, and then progesterone sloughs it away and causes the period to happen. Now, as I say, with the menopause, the natural hormone cycle slows down. Now, this can happen at any age, sometimes even in the sort of 30s. The average age of the menopause usually is around 50. And the symptoms that can happen can include periods becoming a bit more irregular, sometimes quite heavy. It can be real physical changes because estrogen, which is one of the main hormones that goes downwards during the menopause, estrogen is linked in with many of the body's systems, for example, bone metabolism, and also the elasticity of our connective tissues. So during the menopause, some of the common symptoms or signs that can develop are thinning of the bones, literally stiffening up of joints, feeling much sort of stiffer and tighter. Other symptoms can be significant mental health symptoms as well. So people can suffer with new onset anxiety, depression, panic attacks. It can be also very difficult to concentrate, to complete tasks. People can find it difficult to multitask and can lose track of things quite easily. And this is all very distressing and can really erode people's confidence. So there are physical, psychological and cognitive, that's to say sort of memory and brain processing power effects of the menopause, as well as the fact that you can also develop what we call atrophic vaginitis, which is drying the vaginal tissue inside. That can be increasingly uncomfortable. So there are lots of things that happen during the menopause, and it's important, I think, to for women to come forward, to have a chat with their healthcare provider about assessing for whether they could be entering into the menopause, whether they're perimenopausal, that is to say, or whether it's been that the periods have stopped for over 12 months and that they're then postmenopausal. So in terms of the menopause, diagnosing it is often done more on symptoms. Blood tests can sometimes be used, but they're only really helpful towards the latter stages in the menopause, where you often see that the estrogen level goes very low, and something called the FSH, the follicular stimulating hormone level, goes very high, typically above 30, and this can confirm ovarian failure, which is basically that the menopause, the ovaries have stopped working. Now, how do we treat this? So HRT, hormone replacement therapy, is thought of as being one of the mainstays of managing the menopause. It is thought to be safe. Obviously, with any hormonal treatment, there are risks of triggering blood clots and triggering female cancers, but these risks are thought to be very, very low now, and that the benefits of HRT vastly outweigh any potential risks. Now, HRT is typically more commonly given now in topical forms, that's to say applied to the skin, either in patch form, gel form or spray form. Although tablets do still exist very much, they are less commonly used now because the patches or transdermal skin routes are lower risk in general in terms of triggering blood clots compared to the tablets. Overall, all HRTs are considered lower risk anyway, but the patches and gels and sprays are considered lower risk than the tablets. Now, for women that have a womb, a uterus in place, it's important that they receive, alongside estrogen as part of the hormone replacement therapy, that they also receive some progesterone, which is the hormone that works against the estrogen to prevent endometrial hyperplasia, which means increasing numbers of cells developing within the lining of the womb, which can lead to womb cancer, cancer of the lining of the womb. So whenever you have a womb, if you have estrogen, you've got to have progesterone as a protective factor. This can take the form either of progesterone tablets orally, or vaginal tablets, or having a coil placed which has hormone impregnated in it as well, and that can all act as a sort of protection. If you don't have a womb following a hysterectomy, for example, then you only require estrogen on its own. There's debate about the use of testosterone as well, which can be sometimes used to help with boosting people's libido, although depending on the area that you live within the world, that can be a variable factor too. Along with that, it's really important to just eat healthily, practice relaxation techniques, keep very well hydrated. All of these factors help you to cope with the menopause. There are other groups of medications that can be taken, but certainly out of all the main treatments, HRT is thought to be the mainstay of treatment now. So I would encourage you, if you are thinking or feeling that you're entering into the menopause, that you should go and have a chat with your healthcare provider, because there are very effective treatments now that can be very beneficial in a number of ways, both in terms of helping you feel better physically, psychologically, but also in terms of protecting your body in the long term, protecting your bone density, the thickness of your bones, protecting the heart. So there's a number of benefits to come with seeking the correct help and treatment to manage your way through what can be a very difficult time while experiencing and going through the menopause. Hope that's been helpful, and until next time, stay safe.